Uh, Senator Kramer, would you repeat that, please? Could you repeat that?
Senator Benson, I would love to, but the chair has taken her seat. So
Yes.
I think I'm going to mute myself.
Okay.
Good afternoon. The Senate Finance Committee is now in session. We will start with Senate Bill 932, Senator Benson. Senator, you have three witnesses. You take the time that you need to lay out the parameters of your bill. Your chief proponent is Denise Tyson. That person will have 5 minutes, and your other witnesses will have 2.5 minutes each.
Thank you. Thank you, Madam Chair. Thank you so very much. And thank you, esteemed members of the Senate Finance Committee. Senate Bill 932 requires Medicaid, subject to the limitations of the state budget, to provide acupuncture services administered by a healthcare practitioner licensed by the State Acupuncture Board and operating within their scope of practice. Under the current law, Medicaid provides coverage for acupuncture for recipients who are age 20 and younger. Medicaid does not cover acupuncture for adults 21 years and older. You will hear from Denise Tyson, the president of the Maryland Acupuncture Society, Lynn Vance, a practitioner, and Arpa Harchiani, a patient. They will give you 3 different perspectives on why this legislation is so important. And with that, Madam Chair, I would ask and request a favorable report for Senate Bill 933.
All right, thank you very much. We'll start.
Thank you.
Thank you. So we'll hear from Ms. Tyson. I see Denise Tyson is on, but she's got to get unmuted. Okay.
Okay, I just figured that out. Thank you. All right. Good afternoon, the Senate Finance Committee, and thank you, Senator Kelly. And I'm really excited to be here to talk about Senate Bill 932. I'm a licensed acupuncturist with a doctorate in Asian medicine and a co-owner of an integrative health group practice located in Anne Arundel County. Prior to my current career, I worked in healthcare finance and systems for 25 years after receiving my MBA in health administration and finance. I have experience in healthcare in both the clinical and business areas. Currently, I'm a member of the Institutional Review Board of MedStar Health Research Institute, and I am president of the Maryland Acupuncture Society. The Maryland Acupuncture Society is a professional association representing over 1,100 acupuncturists in our state. I'm here to provide favorable testimony for Senate Bill 932, sponsored by Senator Benson. This bill will require Medicaid to provide acupuncture services to adults aged 21 years and older. Currently, Medicaid provides acupuncture services for children at age 20 and under. Based on the current fiscal and policy note, Medicaid expenditures will increase. However, acupuncture will reduce costs in other services and prescription drugs, resulting in a decrease in overall cost of delivery. Acupuncture medicine is a part of an entire system of medicine originating in Eastern region of Asia and has been practiced for over 3,000 years. There are many practice styles, and all of them include using filiform needles to stimulate points on the body, which produce a response in all our body systems, such as neurological, cardiovascular, immune, hormonal, lymphatic systems. Acupuncture medicine impacts blood flow, pain sensitivity, emotional well-being, and the nervous system. Acupuncturists are licensed with a master's degree and also can have a doctorate degree with studies which include biomedicine, pharmacology, history and physical examination, both Western and Asian medicine, mental health, pathophysiology, nutrition, clinical red flags such as stroke, deep vein thrombosis, and being able to prevent suicide and many other conditions. As primarily outpatient providers, we practice as small business owners, as solo practitioners, group practice partnerships, private clinics, and nonprofit community clinics. Our patients benefit from our holistic approach to healthcare with a patient-centric delivery model. This model supports preventive care and provider health team collaboration. Acupuncturist's approach to healthcare delivery includes evaluation and management with extensive assessments, vitals to monitor health indicators such as blood pressure, oxygen levels, weight, and body temperature. We will then go through our physical examination and history information to determine a course of treatment, design a treatment plan, and then measure outcomes using standard assessment tools such as pain index, depression scale, low back pain scale, neck pain scale, fibromyalgia scale. There are many different scales that will give us outcome data to let us know that a patient is actually having improvement. Within our scope of practice, we will also review lab results and imaging reports to confirm our treatment plan. That being said, acupuncturists are truly our health partners with our state to improve our health outcomes. And some of the significant areas which I think would be of interest to this committee is that we excel in and have a part to play in the opiate crisis, and also to be able to prevent individuals from overdose or overuse of pain medication, because we are a primary source of pain management. We also are trained as acupuncture detoxification specialists, where we are primary players in delivering a means of individuals to be able to recover from substance abuse. We've been doing this for many years in Baltimore at Penn North, and been successful in having individuals be able to recover from substance abuse. One of the other indicators, I think that including acupuncture for adults would be impactful, is to close the gap on healthcare disparities. Right now, acupuncture, it's covered by the major healthcare insurances, but if you don't have one of these insurance payers covering your costs, then you will have to come out of pocket. That means that there are individuals who are qualified for Medicaid, who have low income or are in a employment where they're not able to have insurance but must have Medicaid. They would have to pay for acupuncture services out of pocket. We've been able, especially during this COVID-19 pandemic, successful in working with individuals with anxiety. There's been quite a bit of that during this time. And also with our pain management, because if individual, because of the overload of our different health systems, that's emergency rooms, different care centers, many of these facilities were not able to service people or patients who had significant pain. And we've had many of these individuals referred to us so that we can provide these acupuncture services. And this keeps this individual from going out trying to find some type of derivative to ease their pain. I would say that, overall, acupuncturists, have been treating children, under the Medicaid service, including the adults now will definitely favorably impact the service delivery in Maryland and help us in many of the trouble areas that we have right now with healthcare. And
I'm
we,
gonna have to butt in to tell you to wrap up because we're running out of.
yeah, I'm finished now. So that's what, in conclusion, is that, you know, acupuncturists are, I think, putting the services in with adults will definitely positively impact Medicaid services.
Okay, let me ask you one question and then other members of the committee might have some. I'm looking at the advice that was sent. It's a letter of information from the Maryland Department of Health. And what they're suggesting is that if we went this route, they do recognize they already do cover through Medicaid for the kids up to 21.
Yes.
But if they were to do what this bill requires in terms of the general population, they're saying it would end up covering up to $30.7 million per year.
Mhm.
I'm not sure what assumptions they're making, but tell me what you think the additional costs might be per patient. Is it more costly to deal with adults using acupuncture than for children? And roughly how many kids, if you know, are being covered in Maryland right now under the status quo?
Well, you know, I'm not sure where the financials were derived from. Acupuncture is typically a lower cost modality because we're using the needles we use. We probably spend about $2 per patient to administer that. Other than that, there might be cost of doing business. Our business doesn't change because we're acupuncturists. When we go to find a space to lease, the rest, we pay the same lease costs as a MD or any other health provider. So some of that might be base costs of that, but for us to administer our services is lower. I am not sure about the number of children that have been serviced under Medicaid so far.
Okay, are there any other questions? Okay, thank you for your testimony. We are going now to Lynn Vance. You have 2.5 minutes.
Thank you very much, Chair Kelly. And I also want to thank Senator Benson. Can everybody hear me?
Yes.
Okay, so my name is Lynn Vance. I am a registered nurse and a nationally board certified licensed acupuncturist. I have over 19 years of experience treating patients, and I'm here to speak, give some testimony as a provider. Primarily, I use acupuncture for chronic pain management, working on integrative teams of medical providers, mostly in a clinic setting. Pain management absolutely is the primary reason why most patients seek treatment. And typically patients choose acupuncture because they very much want to avoid taking medications. People are very aware of the opioid crisis. They want to improve their work productivity. A lot of people say if you're a driver, cannot be on opioids, or if you operate equipment or machinery. So acupuncture serves as a good alternative that does not affect their ability to go to work. It also helps family relationships because as people just function better, they can do more activities with their kids. So as providers, we definitely give care plans that are individualized for the patients. In my experience, patients are very compliant with our treatment regimens, and they often receive pain reduction at the first visit, which helps them come back and be compliant. In addition to pain, like Dr. Tyson mentioned, acupuncture is also, it assists with stress management, and it just provides people a better quality of life overall. And in addiction, for addiction, as part of addiction services programs, we typically use the NADA protocol for treatment of addiction, which is very popular protocol in combination with counseling and medical monitoring. We also teach exercise methods such as Tai Chi and Qigong in combination. And these therapies do very well assisting patients with their nervous system regulation, which helps them stay off of opioids, especially if they're in a program. And I just want to add that a very large percentage of Medicaid patients are struggling with chronic pain, as the rest of the overall US population, and also treatment of addictions as well. Adding acupuncture coverage as Medicaid for adults, it will allow acupuncture providers to help the state of Maryland closing the health disparities gap. And I also want to just add to that final question proposed to Dr. Tyson. I believe, I don't have any firm numbers, but as a preventive service and a preventive type of medicine, acupuncture generally does reduce costs by keeping people out of emergency rooms. So if they're working with an acupuncturist, it's another touch with a healthcare provider that will maybe catch something before it becomes more serious. And also, like I said, just as a preventive service, if they keep coming, we can keep them out of the emergency room. Thank you very much.
Thank you. And I'm going to butt in before I call the next witness, because now I'm looking at the formal fiscal note, and the fiscal note isn't nearly as dire looking as what the health department sent us. The fiscal note is suggesting an increase of 4.6 million per year for the FY 2022 year if we were to pass the bill. Okay.
Yes, ma'am.
The questions. Any questions from members? Okay, we're going now to Arpa Hartani.
Hi, everyone. My name is Arpa. I'm glad to be here with you guys this afternoon. I am a patient over at Dr. Tyson's practice. I have been a patient of acupuncture since probably this summer. I suffer from extreme anxiety disorder, depression, and premenstrual dysphoric disorder. Acupuncture has helped me get back on my feet, to say the least. It has helped me balance my emotions, my physical well-being, my ability to eat and sleep, both of which were very difficult for me at the peak of my disorders. And it has helped me as a Medicaid patient not have to spend as much money on my psychiatrist, on my psychology therapist, which unfortunately were both coming out of pocket for me or had to come out of pocket as a Medicaid patient. Acupuncture was helping me cut back on those payments. I was able to work again. I am a part-time teacher. I work in early childhood education, and it has given me a sort of energy to be with 13, 4-year-olds that I could not work without, in a way. I was really nervous with medications, oral medications, to have side effects such as extreme fatigue or dizziness or an onset of anxiety before it helps your anxiety. And working with kids, those are things that I don't want to have to deal with. So acupuncture helped ground me and smoothen the rough edges of the dysphoric disorder. I really had no choice. As a part-time essential worker during the pandemic, I had to be out there, and I couldn't find a full-time job. So that's why I applied to the state insurance, which has been great. But it doesn't allow me to have coverage of the medical treatments like acupuncture that have helped me so. I had to balance it out, and that's why I'm here today. I also have, as Dr. Tyson was speaking of, a nervous system disorder that makes my nervous system more sensitive. So as you can imagine, everything feels heavier. And acupuncture has helped me be able to maneuver in a much more smooth manner. So that's my case there. Thank you so much.
Okay, are there any questions for this witness? Okay, well, that ends the testimony on Senate Bill 933, and thanks to all the witnesses. Okay, we're going, I mean, I'll get it wrong, 932. We're going now to 933. Senator Benson's going to be up again. Senator, you have the time that you need to lay out the parameters of your bill. Your lead proponent has some amendments, and that's Ramon Luby. And then your other witnesses will have 2.5 minutes each. Okay, you're on.
Okay. Thank you very much, Madam Chair. Madam Chair, members of the Senate Finance Committee, Senate Bill 933 requires the Office of the Commissioner of Financing Regulations to submit a report to the General Assembly by December the 31st, 2021, analyzing the banking environment in Maryland. The report must, 1, include the number and types of state and federal banks and other financial institutions by jurisdictions. Number 2, identify banking deserts in the state where citizens have limited access to financial services or are living in areas without a credit union or bank branch. And 3, recommend strategies to ensure residents of underserved jurisdictions have access to financial services. Senate Bill 933 will create a study that will give important insight and recommendations concerning how the financial services and banking institutions can expand access to these services. You will hear from members of the Maryland Banking Association that will express the need for this important legislation along with other members and groups. Thank you. Thank you for your kind attention, and I would ask that you respectfully give this Senate Bill 933 a favorable report.
Okay,
Thank you very much.
all right, thank you. So far, we don't see your lead witness, so I'm going to go to Bob Enton if that lead witness comes before we're done.
Right. Thank you very much, Madam Chairman and Senator Benson, members of the Senate Finance Committee. Robert Enton on behalf of the Maryland Bankers Association. Ramon Luby, who is the new CEO of Maryland Bankers, took Ms. Murphy's place. Unfortunately, ended up having a conflict of interest today and couldn't be here. But I wish to express on his behalf and on behalf of the Maryland Bankers Association our strong support for Senator Benson's legislation. We have no issue whatsoever with the Commissioner of Financial Regulation conducting this study and reporting back to the General Assembly. Our members are actively involved in communities all over the state and throughout the country in doing everything they can to make banking services available to people in the states where they do business. We work with the American Bankers Association, with the FDIC and federal regulators, as well as other state regulators, to make this happen. We think having to take a look at this is important. We look forward to being active participants and hopefully coming back with practical solutions and information as to what we can do to make sure that people understand how they can bank and the services that are provided. Banking is critical, particularly in this day and age where we move more and more to a virtual world. It can be much more accessible to many more people. We just want to make sure that we can provide these services, and we think the study will be informative, not just for you all, but also for us. So we do support the senator's bill and thank her for putting it in.
Before we go to the next witness, Bob, do you know of a state that is doing anything to help make digital banking more accessible to people who really don't have the funds to, they don't live in an area with 5G or anything, you know.
Yeah, that's certainly something that we're very, very aware of. Particularly, I think we're all so much more focused, maybe now than we were a year ago, on utilizing our cell phones, our laptops, our iPads, whatever you name it, to provide services to our clients. I haven't been in my office in downtown Baltimore for over a year now, not once. But I'm just as busy as I ever was. And I think it's critical as we move forward that we explore how to make services in every way available, whether it's ATMs, whether it's branches, or whether it's digital banking. It's critical. We very, very actively supported bills in the past to increase financial literacy throughout the state of Maryland and make sure that students, as they go through school now, high school, middle school, whatever, get to learn about financial literacy and how important it is. So that's why I say, when we looked at this bill, I said, well, gee, it's not the kind of thing the bankers are necessarily going to come to the table and support, but we respect Senator Benson, and we know this was something that was discussed during the interim. Senator Griffith reached out to me during the interim to tell me that Senator Benson was going to have this bill this year with hope that we could support it, and we're happy to support it.
Okay, let me ask you one other question.
Yes, ma'am.
For the people who can't afford a regular cell phone bill and they don't have a desktop at home, what could you do when the bankers are asked by the Commissioner of Financial Regulation for input? What could you recommend for people who really are essential workers in many cases, but they don't have the income stream? And sometimes some banks and savings and loans and so on want you to keep a certain minimum balance in order to bank there. So what could you do about any of that?
I think that's a point that's been raised. I would tell you that our members offer various options to customers, depending on to what your balance is, what where you bank, what kind of account you're going to have. And our goal is to bank as many people as we can. And I think our banks today, and I know that's something that we'll take don't have a problem taking a harder look at, is making sure that we offer options to meet whatever the needs are of the public, regardless of their income and resources. We want them to bank.
Okay, I'll be calling on Mindy in a minute, but I would just ask that the bankers think about, for the subset of the population that really needs banking services, where they are, deserts in terms of a physical branch they could walk into.
Mhm.
We absolutely will look at that, and we look forward to working with the Commissioner of Financial Regulation to look at all those issues and come up with solutions.
Okay. All right. Are there other questions? Okay, we're going to Mindy Lehman, also Maryland Bankers Association.
Thank you, Madam Chairman, members of the committee. For the record, my name is Mindy Lehman with the Maryland Bankers Association. Just a couple of quick clarifications. The first, I think Mr. Luby just inadvertently signed up favorable with amendment. The MBA is in full support of this bill. We're not offering any amendments.
Okay.
And just a second quick clarification. He had a schedule conflict today, not a conflict of interest. So just a quick point on that. And I do want to highlight, you have a copy of our written testimony. And Madam Chair, I think you raised some really good questions. And attached to our testimony is a press release that the MBA put out a couple of days ago. So as Mr. Enton mentioned, we have been working collaboratively with the FDIC, the Fed, various consumer stakeholders, as well as our national banking trade associations on the FDIC's Get Banked initiative, as well as the Banked On initiative. And the Banked On initiative really focuses on providing safe, functional, and affordable bank accounts. And they were designed for the purpose of getting to some of the problems that people have listed as being reasons why they don't think that they can get a bank account. For example, there's no minimum balance required. There are no overdraft fees. So if you open up a Bank On account, there's a number of safety features attached to that so that the individual is really set up for success and not set up, they won't encounter overdraft fees, for example. So that's something, as Mr. Enton also said, particularly now with being in the midst of a pandemic, we want to make sure that we're getting the financial inclusion and that access to financial services as broadly as we possibly can. Especially, it's the fastest and safest way for individuals to receive things like their federal and state stimulus payments, tax returns, things of that nature. So you do have a copy of that press release. And if it's of interest, the links in there are active, so you can actually go to those sites. Across the nation, there are 80 Banked On coalitions, and we currently have 2 in Maryland. There's one which is the statewide Banked On initiative, and then there's also Banked On Gaithersburg. So we very much look forward to working with the Senator Benson, the bill sponsor, and the other stakeholders, and seeing what we can do to further move the needle on this very important issue.
Okay, and I see Senator Klostermeyer saying.
Thank you, Madam Chair. Mindy and Bob, there's one thing. I had a friend and he wanted to open a bank account, and he had a Medicaid card, and he he thought that would be good enough, so he went and he gave it to the bank, and the bank said, oh no, you have to have a more identification than that. So that is one of the things that I really think is a problem for folks that are in the situation where there's a desert, that they're going to need that identification. And it took 3 trips to the MVA to finally get him a card. So I just wanted to throw that out to you. So we have to figure out something about that. So thank you.
Okay, and I just want to note for the record, the Consumer Protection Division of the Office of the Attorney General has also sent written information in support of this bill. Okay, thanks so much, everybody, and that ends the testimony. All right, we will be voting at 2:30, committee.